Welcome back to Know Your Infections. In today's video, we'll be talking about something everyone should know about, and that is the 5 most common infections that affects people worldwide. What causes them, how they spread, and the signs you should never ignore. Let's get into it. The first on my list is common cold. Common cold is an upper respiratory tract infection, and it's usually caused by rhinovirus. Although coronavirus can also cause common cold. The common symptoms that you would experience are runny nose, cough, mild or no fever, tiredness, and even sore throat. How do they spread? This usually spread by droplets of sneezing or coughing. Also, it can be contacted when you touch a contaminated object. How can common cold be managed? Simply rest, staying hydrated, and paracetamol if needed to relieve pains. It's important to note that any common cold that exceeds 7 to 10 days may likely have been infected by bacteria. So it's important that you seek the advice of your health practitioner after 7 to 10 days. The next on my list is UTI, and that is urinary tract infection. Now, this is mostly caused by bacteria. For example, Escherichia coli from your guts. It majorly affects women, catheter users, and older adults. The symptoms that may be pointing out to urinary tract infection include burning sensation while urinating, urge to urinate, but at the end, little or nothing comes out, pain in the pelvic area, that is the lower belly, and also cloudy or smelly urine. Now, how does it spread? This is not directly contagious. However, it happens when bacteria enters the urinary tract, maybe by not maintaining a proper hygiene, engaging in sex, or even dehydration. How is this being treated? Remember that it is caused by bacteria, so you make use of an antibiotic prescribed by a medical practitioner. Also, staying hydrated can help flush away this bacteria. It's also important to note that while wiping, do not wipe from back to front. Instead, wipe from front to back. Next is gastroenteritis. Have you ever noticed that you're, persistently vomiting or pooing after eating out? That is gastroenteritis. It's also known as stomach flu. Now, this usually occurs as a result of bacterial, fungal, or parasitic infestation. The common viruses involved are norovirus and rotavirus. Then the most common bacteria involved is salmonella, which majorly causes typhoid fever. Then the common parasite involved is Giardia. The common symptoms include diarrhea, vomiting, stomach cramps, fever sometimes, then in severe cases, dehydration. How does this spread? This spreads through contaminated food or water. It also spreads by touching infected individuals. If infected by stomach flu, it's important to know what is causing it. If it's caused by virus, then you do not require an antibiotic. Just taking your ORS to hydrate yourself is key. Taking in enough fluid is important. But if caused by bacteria, for example, salmonella, it's important to get the antibiotic to target it. On my list is skin infection. We have 3 different types: the bacterial, viral, and the fungal. Example of the bacterial skin infections are impetigo, cellulitis, and boil. Examples of fungal infections are athletic foot, and ringworm. Example of viral infections are herpes and warts. Now, for the symptoms, it's important that for the bacterial skin infection, the significant symptoms are redness, warmth, and the presence of pus. If caused by fungi, the important symptoms to look out for are flakiness and itchiness. And if caused by virus, the important symptoms to look out for is blisters, which may or may not be painful. Now, how does skin infection spread? Skin infection spreads through direct contact, sharing of materials, for example, gym equipment. Also by sharing towels. Now, how can this be treated? Skin infections are usually treated depending on the cause. So if it's caused by bacteria, then an antibiotics will be used. If it's caused by virus, then antiviral medications would be used. If it's caused by fungi, then either oral or topical antifungal would be used. Key points. Ringworm isn't caused by a worm. The name is coined from the appearance, as it appears in a ring-like shape. It's actually caused by a fungus.